Hello and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's top health news. NEET PG Counselling 2022 MCC withdraws round 1 provisional results and begins choice filling options once again. MCC has withdrawn the provisional results declared and has begun the choice filling process yet again for the NEET PG Counselling 2022. The new round 1 schedule has also been released. It is hereby informed to all the candidates participating in NEET PG Counselling 2022 that the provisional result for round 1 of PG Counselling, which was uploaded on 27th of September, is being withdrawn since some PG DNB institutes did not complete their address profile on portal, due to which their seats were not visible when state filter was applied by the candidates during choice filling, even though their seats were included in the seat matrix of round 1 and were available for choice filling. Keeping in view the larger public interest, the competent authority has decided to open the choice filling again and issue a fresh result for round 1 as per following schedule. The candidates are advised to keep in touch with the MCC website for latest updates and make travel arrangements only after declaration of final result. AIIMS bars doctors, faculties to interact with media. Only designated officials with prior approval allowed. Implementing a ban on doctors, faculties and officers from interacting with media, the All India Institute of Medical Science, New Delhi has clarified that only designated officials will be allowed to talk to media on the issues of functioning of AIIMS after getting prior approval from competent authority. The Premier Medical Institute AIIMS notified about this ban on media interaction after the new director Dr. M. Srinivas took over. After taking over, the director Dr. Srinivas has also issued another order clarifying that the files should be submitted in electronic mode except for the confidential ones. Only MD DNB Dermatology MCH DNB Plastic Surgery should perform aesthetic surgeries including hair transplant. Ordering a crackdown on the mushrooming practice of unethical and illegal aesthetic surgeries including hair transplant, the NMC has recently stated that only properly trained, licensed, registered medical practitioners, that is, practitioners of modern medicine, are eligible for conducting such procedures. Issuing guidelines, the Ethics and Medical Registration Board of NMC has recommended DNB Plastic Surgery, MD or DNB Dermatology with adequate grooming in dermatological surgical procedures for conducting hair transplantation surgeries. It is also noted that the above named specialties have hair transplantation as a core topic in their curriculum, and NMC explained in the guidelines. Apart from this, the apex medical body has also barred any untrained person from conducting such surgeries, while noting that such procedures are not an emergency surgery and therefore people cannot be allowed to conduct these surgeries under the pretext of exceptional circumstances. It may be noted that watching in workshops or on YouTube or any other similar platform is not adequate training to start aesthetic surgeries, clarified the Ethics Board of NMC. Referring to the hair transplantation surgeries, the High Court bench had observed at that time that hair transplantation, being an aesthetic surgery, needs to be performed by qualified dermatologists or trained surgeons with informed consent of the patient. Now, the Ethics Board of NMC has come up with a guideline for aesthetic surgeries and hair transplantation and has barred untrained professionals from conducting such procedures. Atal University to now offer MBBS in Hindi, said Union Minister Amit Shah. Referring to the National Education Policy 2020 that promotes technical courses in mother tongue, Union Home and Corporation Minister Amit Shah announced that from October 16 this year, Atal Bihari Vajpayee Vishwavidyalaya in Bilaspur, Chhattisgarh will offer MBBS in Hindi. He said some people might find this strange, but I want to reiterate that when students think, talk and study in their mother tongue, they can research better, unlike rote learning. That is the reason from 16th of October, Atal Bihari Vajpayee Vishwavidyalaya will offer complete first semester of MBBS course in Hindi. That's all from the health world. Now we have Mr. Zaman to update us about happenings in the medical world.
I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Smart devices like Siri, Alexa might hinder kids' social and emotional development. Voice controlled smart devices such as Alexa, Siri, and Google Home might hinder children's social and emotional development, argues an expert in the use of artificial intelligence and machine learning in healthcare, in a viewpoint published online in the Archives of Diseases in Childhood. These devices might have long-term effects by impeding children's critical thinking, capacity for empathy and compassion, and their learning skills, said Anmol Arora of the University of Cambridge. While voice-controlled devices may act as friends and help to improve children's reading and communication skills, their advanced AI and human-sounding voices have prompted concerns about the potential long-term effects on children's brains at a crucial stage of development. There are three broad areas of concern, explains the author. These comprise inappropriate responses, impeding social development, and hindering learning. The author cited some well-publicized examples of inappropriate responses, including a device suggesting that a 10-year-old should try touching a live plug with a coin. Now, it's difficult to enforce robust parental controls on such devices without severely affecting their functionality, they suggested, adding that privacy issues have also arisen in respect of the recording of private conversations. These devices can't teach children how to behave politely because there's no expectation of a please or thank you and no need to consider the tone of voice, the authors pointed out. A test could predict the likelihood to get long COVID. A blood test taken at the time of COVID-19 infection could predict who is most likely to develop long COVID, suggests a new small-scale study led by UCL researchers. The study, published in Lancet eBiomedicine, analyzed proteins in the blood of healthcare workers infected with SARS-CoV-2, comparing them to samples from healthcare workers who had not been infected. Usually, protein levels in the body are stable, but the researchers found a dramatic difference in levels of some of the proteins up to 6 weeks following infection, suggesting disruption to a number of important biological processes. Using an AI algorithm, they identified a signature in the abundance of different proteins that successfully predicted whether or not the person would go on to report persistent symptoms a year after infection. The researchers say that if these findings are repeated in a larger independent group of patients, a test could potentially be offered alongside a PCR test that could predict people's likelihood of developing long COVID. For the study, the researchers analyzed blood plasma samples from 54 healthcare workers who had PCR or antibody-confirmed infection taken every week for 6 weeks in spring 2020, comparing them to samples taken over the same period, 102 healthcare workers who were not infected. The researchers found abnormally high levels of 12 proteins out of the 91 studied among those infected by SARS-CoV-2, and that the degree of abnormality tracked with the severity of symptoms. The research team found that at the time of first infection, abnormal levels of 20 proteins studied were predictive of persistent symptoms after 1 year. Most of these proteins were linked to anticoagulant and anti-inflammatory properties. Dogs can smell the stress odor in humans, says research. Dogs can smell stress from a human's sweat and breath, a new study by Queen's University of Belfast researchers has found. The study involved 4 dogs from Belfast, Trio, Fingal, Soot, and Winnie, and 36 people. Researchers collected samples of sweat and breath from participants before and after they did a difficult maths problem. They self-reported their stress levels before and after the task, and researchers only used samples where the person's blood pressure and heart rate had increased. The dogs were taught how to search a scent lineup and alert researchers to the correct sample. The stress and relaxed samples were introduced, but at this stage the researchers didn't know if there was an odor difference that dogs could detect. In every test session, each dog was given one person's relaxed and stretched samples, taken only 4 minutes apart. Now, all of the dogs were able to correctly alert the researchers to each person's stress sample. The research highlights that dogs do not need visual or audio cues to pick up on human stress. This is the first study of its kind and provides evidence that dogs can smell stress from breath and sweat alone, which could be useful when training service dogs and therapy dogs. Emotional connection with the parent can improve brain development of the preterm baby. A joint study by the University of Helsinki and Columbia University showed that supporting emotional connection between mother and her premature baby following birth in the hospital ICU improves the baby's brain development. In the current study, the brain network functions of premature infants were measured at term age following approximately 6 weeks of family nurture intervention or FNI in the neonatal ICU. All babies received normal high standard premature care, but some families were given additional FNI to strengthen mother-infant emotional connection. The study showed that such parental support during the intensive care treatment removed the developmental abnormalities in brain function that are typically seen in the prematurely born infants. The brain network function of the premature infants in the treatment group were not different from their control peers that were born at the normal term age. Treatment of premature babies in the ICU has improved enormously, but supporting brain development is still a global challenge. Along with treatment innovations, better methods are needed to measure how the new treatments directly affect the developing child's brain, said Professor Samsa Vanhatalo, who led the research. That's all from the medical world. Now we have Dr. Nandita Mohan, who will be providing us medical journal updates.
Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan and I'm going to discuss about the increasing rate of obstructive coronary artery disease in both young men and women, accounting for 10% of all coronary artery disease cases and all of them requiring a percutaneous intervention. The study is recently published in the Indian Heart Journal. Now, in developing countries like ours, cardiovascular diseases have surpassed cancer as the leading cause of death and morbidity. Now, in reference to the United Nations Declaration on Non-Communicable Diseases in 2011, the WHO defined a target of lowering the likelihood of premature death from these by 25% by 2025. So this retrospective study, it aimed to explore the prevalence of risk factors as well as the trends of obstructive coronary artery disease in Indian females under the age of 45 compared to males of the same age group who underwent a PCI procedure at 3 high-volume centers in India. Out of the close to 3,600 patients who were enrolled for the study, 3.1 of these had an obstructive coronary artery disease. They were young women, while 6.9 were young men. Traditional risk factors such as hypertension, diabetes, and family history of premature coronary artery disease were equally common in both the genders, whereas dyslipidemia, overweight, smoking, and alcoholism were more common in the males. The results of the study showed that acute coronary syndrome was the most common clinical presentation. Single vessel disease was common with the involvement of the left anterior descending artery as the most common angiographic feature. The prevalence of cardiogenic shock was 4.4% in females and 4.1% in males, while the in-hospital mortality rate was 1.77% in young females and 2% in young males. Therefore, in conclusion, obstructive coronary artery disease in young men and women accounted for 10% of all the coronary artery disease cases requiring a percutaneous coronary intervention. Now, although men accounted for the majority of the patients, coronary artery disease in women under the age of 45 was not uncommon. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.